Here are my 3 biggest tips for surviving after foot surgery. Number 1, take your pain medication. Foot surgery does hurt. I'm not going to sugarcoat that concept with you, but there are ways to manage that pain. The first thing to understand is that when we're managing pain immediately after surgery, we are trying to manage it. We're not trying to eliminate. So you're not going to be pain-free, but it should be to the point where you can rest easily and it is not distracting you. So the best thing to combat pain is to use your pain medication. Now, a lot of people are afraid about getting addicted to these pain medications and things like that. Don't worry so much about that when you're in acute pain. I am not going to refill your pain medication, so you will not have the opportunity to abuse it. So the first few days, get on a regimen and then slowly work yourself off of it. The vast majority of my patients are off of any narcotic pain medication within 3 days. So it's not going to be long-standing, but don't torture yourself those first 3 days. Number 2, have lots of ice packs. Ice packs help decrease inflammation and help a lot with pain. The hard thing with the foot is icing your surgery, right? You have bandages on, you have a boot on, sometimes you even have a cast. So where to ice your injury is very important. With foot surgery, we recommend putting the ice pack behind the knee. The reason is that the blood vessels are very close to the surface, and so as that blood cools going down to your foot, it's going to decrease some of that inflammation and pain. So don't stress out about trying to open up your boot or loosen up your bandages and getting ice packs around your ankle or your foot. Just slip it behind the knee. You can continue to ice however long you want. We recommend 15 minutes an hour. There's no rule that you have to stop after 2 weeks or 3 weeks. If you're in pain, go ahead, throw an ice pack behind the knee and you'll start to feel a little bit better. The third tip is elevation. Now, elevating the foot is actually very crucial. We really do not want that foot in what we call the dependent position because gravity pulls fluid and swelling into that area. And that's going to cause that like heartbeat feeling pain where it's just pounding. So we want to keep that leg elevated so gravity works for us and brings some of that swelling back to the heart. So as much as possible, keep that foot elevated above your heart. Now, you always want to kind of keep your knee slightly bent to not aggravate your back. So pillows is the answer. So put lots of pillows underneath that leg. Try to keep it elevated as much as possible without making the rest of your body achy. Following those 3 tips are going to help you through those first few days when it is very painful having surgery. But like I said, all of this is very manageable and most people are on Tylenol or ibuprofen after a couple of days. So those are my best 3 tips for surviving foot surgery.